Retatrutide is everywhere right now. Everybody is watching, everybody is waiting. And honestly, I understand why. Because the weight loss results are unlike anything we have seen before. For the first time, we are seeing a weight loss medication deliver results that were once exclusive to weight loss surgery. And that is extraordinary. But if I was starting retatrutide tomorrow, I would not treat it like a magic injection. I would treat it like a powerful tool that needs a clear plan. Because retatrutide may help you lose weight now, but without the right plan, you may lose the opportunity to change your health for the long term. I am Dr. Almerie. I am a weight loss surgeon, and on this channel, I help people understand obesity and its treatments so they could make better decisions with confidence. Today, I want to show you exactly how I would think about retatrutide if I was starting it myself. Because after years working in obesity medicine, I have noticed a pattern. I have seen promising treatments produce impressive short-term results, but disappointing long-term outcomes. Because people expected the treatment to do all the work. And I have seen other people completely transform their health through the very same intervention, not because the treatment was different, but because they used it to support a much wider change in their health. So in this video, I want to share the retatrutide success plan, a plan based on 5 essential rules designed to help you use it more safely, avoid common mistakes, protect your body, and turn short-term weight loss into long-term success. So let's build your retatrutide success plan. The first rule is simple: respect the drug. Do not chase the highest dose, chase the right dose. Because with medications like retatrutide, people do not all respond in the same way. I have seen this again and again while managing patients on GLP-1 based medications over the last few years. The dose where one person gets excellent appetite control may be completely different from the dose another person needs. Some people feel strong satiety very early. We often call them high responders. Others need a higher dose before the benefit becomes clear. And some people start getting side effects before they ever reach the dose that gives them the best weight loss effect. That is why there is no golden number. So the safest pathway is not complicated. You start low, you increase slowly, you give your body time to adapt, and with medical guidance, you adjust the dose until you find a meaningful response. The hunger feels more settled. The food noise starts to quieten, and you feel more in control. That is the response you are looking for. And when you reach it, you do not need to keep chasing the next dose. But sometimes the body gives a very different answer. As the dose goes up, side effects can become more troublesome. You feel constantly sick. Reflux becomes harder to control. Palpitations appear. You feel weak, washed out, or unable to eat enough. And this is where people can get trapped. Because when the weight is finally coming down, it becomes tempting to ignore what your body is telling you. But those symptoms are not a challenge to push through. They are a signal to pause. Sometimes the right move is to stay at the same dose and give your body more time to adapt. Sometimes the right move is to step back. Do not feel ashamed and do not compare your dose with someone else. Your biology is different. Your response will be different too. So I would aim to find my own sweet spot, the lowest dose that gives me meaningful benefit with side effect I can safely manage. And that is the dose I would aim for if I was starting retatrutide tomorrow. The second rule I would follow if I was taking retatrutide is to pay attention to the signals my body is giving me. Because when the weight is falling and the scale is moving, it's easy to assume everything is going well. But sometimes success on the scale can hide problems developing underneath. A faster heart, palpitations, a lower mood. These are not signals to panic about, but they are certainly not signals to ignore. The first place I would start is my heart, because one of the more consistent findings with retatrutide in clinical trials has been an increase in resting heart rate and sometimes changes in heart rhythm. Studies showed an increase of around 7 to 10 extra beats per minute. Now that may not sound dramatic at first, but that adds up to roughly 14,000 extra heartbeats every single day. Almost like asking your heart to work a little harder day after day. There have also been reports of palpitations or rhythm changes in some people, especially at higher doses. So if I was going to start retatrutide, I would want to know my baseline heart rate and monitor how it changes over time. This is where a simple smartwatch or fitness tracker can be useful for spotting trends. Not to diagnose heart problems, but to notice if your resting heart rate is changing from the baseline. Now, if you develop palpitations, dizziness, or chest pain, do not rely on the watch. Speak to your doctor, and if these symptoms are severe, sudden, or worrying, seek urgent medical advice. The second thing I would pay particular attention to is my mood, because this may be one of the most unexpected changes. For most people, as the weight falls, they expect to feel better. But occasionally, some people on retatrutide describe something very different, a feeling that life has lost some of its color. The things they once enjoyed do not feel quite the same. Music, hobbies, even simple pleasures, almost like life has shifted into grayscale. Now that can feel particularly confusing because on paper, everything is going in the right direction. The scale is moving, the clothes fit better, people are complimenting your weight loss, yet something inside feels the opposite. Feeling low while achieving something you have wanted for a long period of time is not something you should simply push through. I would discuss it with my doctor. So the second rule I would follow if I was starting retatrutide is simple. I would not just watch the scale. I would watch myself. For me, keeping an eye on my heart and on my mind would be paramount. But I would also watch for any other signals my body is giving me, and I would act early when something does not feel right. The third rule I would follow if I was starting retatrutide tomorrow is this: protect your muscle before the weight starts falling. Muscle loss has become one of the biggest talking points around GLP-1 medications, and retatrutide should not be assumed to be an exception. If anything, muscle protection matters even more here, because the weight loss appears greater than what we have seen with previous GLP-1 medications. You have probably seen this happen. Celebrities, friends, people around you, someone loses weight. The waistline shrinks. The clothes fit better. People celebrate the transformation. And of course, that can be a wonderful thing. But sometimes they miss what may be shrinking alongside it. Strength, power, physical reserve, the things that help you stay capable as you age. And that is the hidden risk. Muscle is not decoration. Muscle helps you climb stairs, lift shopping bags, get out of chair, catch yourself when you trip, stay independent as you get older. That is what you are trying to protect. Muscle loss should not be accepted as an inevitable price of weight loss. It should be treated as something we actively try to prevent. When energy intake falls, the body does not only draw energy from fat, it can also draw it from lean tissues, including muscle, especially if your body does not receive regular signals to keep these muscles. And sending those signals should be a core part of your weight loss plan. The first signal is movement, and the strongest form of movement for muscle protection is resistance training. Resistance trainings tell your body, keep the muscle, I need it. Resistance training doesn't need to be in the gym. This can be something you do at home. Bodyweight exercises, chair squats, wall push-ups, resistance bands, simple movements you can repeat. Even 15 to 20 minutes a day is a great starting point. I have left a few selected links in the description of this video showing simple bodyweight resistant exercises you can start doing at home today. No special kit, no complicated setup, no expensive gym membership. Start with what you can repeat, then build from there. Now the second signal is protein, and this one is easy to miss because protein provides the building blocks your body needs to repair and maintain muscle. When appetite falls and portions get smaller, protein intake can drop without you noticing. So when planning your meals, think protein first. Eggs, Greek yogurt, legumes, fish, lean meat, nuts. These are protein-rich foods that can help you protect your muscles during weight loss. Now I know counting protein grams in every portion can sound complicated, but adding one protein-rich food to each meal is simpler and more straightforward. And if you struggle to get enough through food, a simple protein supplement like whey protein can be useful. So rule 3 is simple. Do not just ask, how fast can I lose weight? Ask, how much muscle can I keep while the weight is coming off? When retatrutide starts working, appetite falls. And when you eat less, you're not only reducing calorie intake, you may also be reducing proteins, vitamins, minerals, and essential micronutrients that help your body run smoothly. The problem is you may not notice that straight away. So before you rush to buy every supplement marketed to GLP-1 users, let me explain how I think about this. Many people go wrong with supplements. Some take everything, others take nothing, and both extremes can cause problems. So now you may be asking, what should I take then? Well, I approach this very similarly to how I manage my weight loss surgery patients, because retatrutide may eventually produce a similar magnitude of weight loss. And when someone is losing a large amount of weight, I want a simple safety net in place. After protein, which we have already covered, the foundation for most people is surprisingly simple. A good quality multivitamin. That's it. It helps cover the key vitamins and minerals your body needs. It's a baseline to fill those small gaps before they turn into real problems. Beyond that, additional supplements should be based on need. Vitamin D, vitamin B12, iron, folate, zinc. These should not be guided by fear or marketing. They should be guided by your needs, symptoms, blood tests, baseline deficiencies, or specific risk factors. So rule 4 is simple. Do not take everything. Do not take nothing. Build a simple supplement safety net that fits your individual needs and protects you while losing weight. Now, the 5th rule, and perhaps the most important one I would follow if I was starting retatrutide tomorrow, is this. I would not let retatrutide become autopilot weight loss. Because let's be honest, if you are taking retatrutide for weight loss, there is one question that quietly sits in the back of your mind. Will I need this forever? And if I stop, will all the weight come back? You may not say it loud, but you feel it. Now let me say this clearly. Obesity is a chronic disease. Chronic diseases often need ongoing treatment. Staying on treatment is not failure, it's management. For some people, long-term treatment may be exactly the right plan. But the reality is, many people do stop. Not because they are careless, not because they failed, but because real life gets in the way. Costs, access, side effects, life changes. That's why you need to think about this early. Not to prepare for failure, but to prepare for maintenance. Autopilot weight loss is when retatrutide controls your appetite so you eat less, but you eat less of the same foods. You carry on with the same old habits, the same environment, the same routines, no structure, no plan, just the same life with the smaller portions. And yes, the weight may fall because the medication is doing the heavy lifting, but this can make you very vulnerable to weight regain if you ever need to stop. Because if your old system has not changed, the old patterns that pushed your weight up are still there, waiting, pulling, ready to take you back where you started. And this is why I would never use retatrutide as autopilot weight loss. I would instead use it as an opportunity, because when the drug controls the food noise, I have a window to build habits that were much harder to build before, a window to eat more real food, to plan meals, to make movement part of my normal life, to change difficult habits I have, to change the environment that made weight gain so easy for me. Because these habits are not just weight loss habits, they are longevity habits. And if one day retatrutide stops doing the heavy work, and that day may come, I do not want to discover that nothing else was holding me up. I want to build a system strong enough to protect my progress and help me keep the results for the long term. So retatrutide may help you cross a river you have struggled to cross for years. A river with high tides, hunger, food noise, weight regain, old patterns pulling you back. But the worst outcome would be this: to use a medication this powerful, get good short-term results, only to end up back in the same yo-yo weight cycle months or even years from now. So if I was starting retatrutide tomorrow, I would use these 5 rules to get the best out of this drug and give my progress a better chance of lasting for the long term. If you have not seen my previous video on the latest retatrutide results, watch that next, because in that video I explain why the latest data has created so much excitement around retatrutide and why it could become one of the biggest developments in obesity treatment. You will find the link up here. And if you feel lost in the noise around GLP-1 medications, I have put together a full GLP-1 playlist to help you make sense of it. Side effects, supplements, weight regain, no hype, no sponsor, just evidence-based guidance that combines the science with real clinical experience. Because my goal is to build a place you could come to for clear information about obesity and its treatments, so you can make better decisions for your health with confidence. Now, if this video helped you and you watched this far, I would really appreciate if you could give it a like. It helps this information reach more people who may need it. I am Dr. Almerie. Thank you for watching, and I will see you in the next video. Stay informed, stay healthy.